ACDEP and Cordaid have collaborated in a number of development programs in Northern Ghana in the area of agriculture for small producers, microfinance support for agriculture and income generating activities for women's groups, and also in the area of health. Basically, what ACDEP and Cordaid are looking at, where are the gaps that ACDEP and Cordaid can work together to complement what government is doing. So on the basis of that, we're looking at three main areas. One of the areas is adolescent reproductive health. Because, you know, in the primary healthcare system, that is one of the areas that is less emphasized.
The program tries to capture adolescents both in school and out of school. And some of the strategies we use are the behavior change communication strategy, capacity building of the main actors. And basically what we try to do is to meet with the adolescents, educate them on their reproductive health, try to demonstrate that through role plays, drama, video shows.
Having many girlfriends or boyfriends increase the risk of getting STDs, including AIDS. True or false?
My name is Colbert Rita. I'm attending Walawale Senior High. We learned a lot about the use of condoms, how to abstain, assertiveness, adolescent reproductive health, counseling, decision-making, teenage pregnancy, the effects of it, and then HIV/AIDS or STIs.
There are cultural and traditional barriers to talking about reproductive health to adolescents. And so together with Cordaid, we are looking in the health area as to what is it that we can do to target the youth.
We have both in-school and out-of-school clubs because we believe that the fact that an adolescent is out of school doesn't mean that he or she should be totally out of the education that goes with the reproductive health project.
My name is Jato Israel. I'm a peer educator. Some of the challenges we face in our classes, drug abuse by students in campus, and then premarital sex, immoral behaviors. But as peer educators, we are able to explain to them something like drug abuse. We explain the dangers involved in it. The rate at which people use drugs in campuses are now down. So I'm happy with that.
Every organization is taking advantage of new technologies. And ACDEP will also want to explore and make use of ICTs to improve the work that we do at the community level. Adolescents in school and out of school use computers to access information about their adolescent reproductive health and then their needs. And they're able to share same with their colleagues.
The other aspects of the ICT component of the project is also to attract the adolescents to the health facilities. When they see you going into the health facility, especially when you are healthy, they assume that you are going in for an abortion or something. So because of that stigma that was attached to that, we try to use the ICT center as a tool to be able to attract the adolescents to the health facilities.
Good afternoon. You are welcome. Please have a seat.
Some people expose them to sunlight and they hate that this condition. What condition? So now,
through this education, I'm able to educate my colleagues and then at the same time myself in question, because some people see changes in their bodies and then they become afraid or scared, or they are sometimes sad or disturbed. So through this, some of them are able to, and now everybody is happy of these things happening, and at the same time this education going on or program going on in our society.
Some of the major challenges we have faced as far as the implementation of this project is concerned is funding. As you can see from the background, you realize that there are more students at the background who would like to use the computers, but we have only 2 computers because that's what we can afford to provide for now. We have more areas, interested in the adolescent health project, and considering our current capacity in terms of funds, we are actually looking forward to and working towards raising more funds to be able to support the extension or the expansion of the project in the near future.